about prostatitis, right? That swelling and inflammation of the prostate gland.
Yep.
And men commonly will go to their doctor and be treated with, given antibiotics, and then shocker, it won't work.
Right.
Why?
It doesn't work because it's not treating the cause of the prostatitis. Oftentimes there is no infection involved, or at least no infection that one can gather from a urinary analysis or urine culture.
And antibiotics, again, has to be a bacterial infection for it to be effective.
For it to be effective,
Right.
it should be a bacterial infection.
Right.
Now, the go-to is still antibiotics, and what happens is that patients do actually better for a brief period of time, sometimes, then they do worse, then it comes back.
Why would they do better for a brief period of time?
Because there might be a low-level infection in their prostate that none of our tests can actually detect. So that might be it.
Right.
Could also be placebo. We know that the placebo effects work 30-40% of the times as well.
Right.
So those are the reasons why. Now, the problem with antibiotics is two things. Number one, it clears the flora, the healthy bacteria from the gut. We know that those with poor flora in their gut actually have worse prostatitis symptoms. The other thing is that it creates resistant bacteria. This is across the board with overconsumption of antibiotics. So these are huge problems. Now, you treat the prostate, or at least in my clinic, you treat the prostate by not treating the prostate. In other words, you're not prostate specific. You treat the person.
So if it's not an infection, why is it inflamed in the first place? What's the root cause of prostatitis?
So the root cause of prostatitis can be an infection at some point in their life. Could be 10 years prior to their symptoms. And then there's always that constant systemic inflammation on their prostate. That's always lingering there, causing symptoms. The symptoms are pain and urinary problems. Now that's key, because you have to differentiate between that and enlargement of the prostate. Prostatitis presents with both pain in the scrotal area, or what's called the perineum between the scrotum and the anus. Sometimes it's referred pain in her thighs, lower abdominal section, and urinary problems, frequency and urgency. The other thing is that most prostate problems occur in men as they age. With prostatitis, it actually occurs in young men. This is a few times where there's actually men that are 25 years old walking in with a prostate problem.
Okay, so young guy walks into a bar, young guy walks into a doctor, and he's got inflammation and urinary issues, and you're not giving him antibiotics. What are you telling him?
Well, the treatment approach is a variety of things. Oftentimes, these men have other issues. IBS, or irritable bowel syndrome. They have constipation, diarrhea, all kinds of digestive. They get bloated after eating, very gassy. You have to treat the gut to treat prostatitis. Actually, the digestive system and the urinary system are connected through the same nervous system. So you have to treat the gut. So constipation makes things worse.
So theory being, because the prostate is inflamed, there's inflammation throughout the body, and your goal is to reduce that inflammation.
Correct. My goal is to, that's the more direct way. My goal is to treat this person as a person. There's also an element of anxiety, type A personality with regards connected to prostatitis. So kind of get them, I always say, I work in New York City. I always say, there is nothing less than a type A minus. So it's a matter of, are you a type A plus or type A or a type A minus in New York City? So if you're a type A plus, how can we get you to just being a type A? And so there's breathing exercises that we do. Lastly, there's also acupuncture. Acupuncture has shown in over 500 men in studies to be extremely helpful, at least from treating the pain of prostatitis, if not the urinary problems as well. So there's a lot of multiple things to do, but I'll say this, as a practitioner that practices mostly natural medicine, I'm very agnostic as it relates to how I practice. I only care for what works. In this particular case with prostatitis, I can say with very high certainty that natural medicine works best for prostatitis as opposed to treating with antibiotics or prostate drugs to a 25-year-old.
And again, I'll just sum up a little bit, because we've talked in a few different angles. Prostatitis really is more of an inflammatory issue and a lifestyle issue. So to treat it by calming the inflammation, easing the stress, some lifestyle shifts to be able to calm that area of the body.
Absolutely.
Cool. Thanks so much, Dr. Geo.
My pleasure.
If you liked what you just saw, we have a whole lot more with Dr. Geo Espinosa at our website, bottomlineinc.com. And do me a favor, share this, tell your friends. We have so much great information. Come to bottomlineinc.com.